Desire mismatched to simple words that conceal a storm of emotions. In countless relationships, one partner longs for intimacy more often than the other, and what begins as a quiet difference can slowly evolve into arguments, distance, or even the collapse of a bond that once felt unshakable. Specialists note that mismatched libido is one of the most common concerns that brings couples into therapy. The most frequent sexual difficulty reported by women is low desire, and this very challenge once became central in the life of Dr. Anna Good, a respected urologist and surgeon. Her story, both personal and professional, reveals how science, honesty, and persistence can transform a struggle into renewed closeness. But what exactly made the difference in her journey? At the heart of the problem stood a contrast. Her partner possessed a vigorous, steady libido, while her own sexual desire had faded. The contradiction was not about attraction. She loved him, found him appealing, and valued their intimacy. The act itself was satisfying. The challenge was desire. The spark that initiates closeness had weakened, and even the responsive desire that often grows during the act had diminished. The imbalance began to surface in their daily life. Occasional quarrels emerged, sometimes sparked by trivial matters but fueled by the deeper frustration of unmet needs. In such moments, both sides silently carried wounds, one feeling undesired, the other guilty or pressured. Could a marriage survive this silent battle? Psychologists emphasize that both partners' feelings must be validated. On one side stands the person with lower desire, burdened by guilt and confusion. On the other side, the partner with higher desire may experience rejection as a denial of intimacy itself. For many men, research suggests physical intimacy is not merely pleasure, it is their primary gateway to emotional connection. For many women, the process is reversed. Connection often precedes desire. When these two realities collide, tension brews. Dr. Good recognized this truth and chose not to dismiss it. She resolved to search for answers, determined to bridge the gap rather than let it widen. But where could solutions be found? Modern medicine offers tools, though none are instant miracles. Dr. Good openly explored treatments. Among the FDA-approved options were flibanserin and bremelanotide, both designed to support female sexual desire. She tried both, studying their effects not just as a patient, but as a scientist. Beyond that, she turned to testosterone therapy prescribed properly under supervision for low libido. Here lies a critical lesson. None of these substances function like a light switch. Desire cannot be switched on in an instant. The body and mind must align, and countless influences shape the outcome. Could medication alone ever truly solve the issue? Other elements proved equally important. Sleep, for instance, emerged as a hidden culprit. When exhaustion dominated her life, doctor, entrepreneur, mother, wife desire slipped further away. Once rest became a priority, interest returned. Here the story expands beyond medicine. Libido does not live in isolation, but within a network of daily habits, emotional states, and personal identities. Constantly wearing professional or maternal roles made it difficult to enter the role of a partner. By deliberately shifting focus, by setting aside doctor or entrepreneur and stepping fully into wife, she created space for intimacy to breathe again. But could mindfulness strengthen this fragile renewal? Indeed, mindfulness became a cornerstone. By consciously anchoring attention in the present moment, she discovered that desire can be cultivated rather than awaited. When distracting thoughts about patients, schedules, or household demands intruded, she redirected energy into the present encounter. A book, Better Sex Through Mindfulness, illuminated the practice further. Step by step, intimacy grew not as an automatic impulse, but as an art of focused presence. Was this enough? Or did the mind itself hold even deeper keys? This question led her to sex therapy. To Dr. Good, therapy is not a last resort but an essential partner in sexual health. She advocates it for nearly every patient, regardless of whether the issue is low libido, erectile dysfunction, premature ejaculation, or difficulty with orgasm. All such conditions live partly in the body, but profoundly in the mind. A sex therapist, she often explains, serves as a guide through tangled thoughts, anxieties, and unspoken fears. In her own practice, she built a network of certified therapists, personally contacting every specialist she could find in Chicago. Many were surprised few physicians had ever reached out before. The collaboration proved invaluable, bridging medicine and psychology in a field too often divided. Why then does society still hesitate to normalize such help? Misconceptions linger. Many hear the term sex therapy and imagine deviance or addiction. In truth, most therapists address ordinary struggles shared by countless couples. Rejections, mismatched expectations, changes in sensation all are common. All are human. By reframing therapy as guidance rather than judgment, Dr. Good highlighted its true purpose, restoring connection and reducing silent suffering. With therapy, medical treatment, mindfulness, and lifestyle changes, her own intimacy gradually revived. But the process was ongoing, never a one-time cure. Could this persistence be the hidden secret behind lasting desire? Relationships are dynamic, and so are needs for intimacy. Sociologists point out that many men perceive sex as their primary expression of closeness, while many women perceive closeness as a prerequisite for sex. When these expectations clash, silence often replaces dialogue. Partners may not voice frustrations until they explode in unrelated conflicts. A sudden outburst over household chores may mask months of sexual rejection. Dr. Good recognized this pattern in her own life and began addressing it directly. Open conversation revealed hidden feelings, rejection, loneliness, frustration. Could simply talking transform the battlefield into common ground? Communication proved both difficult and vital. Cultural silence around sex leaves many unprepared to speak openly. Even long-married couples may never discuss what they truly enjoy in bed. Yet desire evolves. Nerve sensitivity decreases with age. What once brought pleasure may later fade. Without conversation, partners continue repeating old patterns, mistaking routine for satisfaction until boredom quietly erodes passion. Here lies another paradox. Love does not guarantee sexual compatibility. Only dialogue can sustain it. But how can such vulnerable words be spoken without wounding pride? Experts recommend framing feedback with care. For instance, if a particular touch no longer excites, presenting it gently as guidance rather than criticism transforms the moment into opportunity. Each partner remains an individual with unique preferences. Feedback should be welcomed as a gift of understanding rather than an insult. Adapting together turns challenges into shared growth. Yet raising the subject is never easy. Timing matters. Choosing a calm walk, a quiet drive, or even playful role play can soften the edge of difficult truths. Dr. Good herself enjoys a game of pretending to be strangers at a bar, rekindling the thrill of first encounters. Such creativity demonstrates that desire is not lost, it can be reignited. But does this mean intimacy must forever be cultivated, never taken for granted? Indeed, the conclusion is clear. Desire is cultivated. It is not a static flame, but a garden that must be tended with attention, patience, and care. Every couple faces risks of routine fatigue or misunderstanding. Yet through therapy, medicine, mindfulness, and honest conversation, renewal remains possible. And when partners recognize intimacy as both fragile and precious, the effort to sustain it becomes not a burden, but a bond. Could this be the ultimate lesson hidden within the struggle of mismatched libido? The story of Dr. Anna Good demonstrates that mismatched desire need not end in distance. It can spark dialogue, motivate self-care, and reveal deeper truths about connection. Sexuality changes over time, but relationships can change with it. The secret lies in refusing silence, in daring to speak, to listen, and to grow together. Intimacy, after all, is not a single act. It is a lifelong conversation, one that, when cultivated, can remain as vibrant and renewing as the first spark.